Okay, guys, I'm going to walk through our flow for one of these guys, right? So, right now, we're going to make an appointment for a test, and we're going to make that for me. I'm blocked off for surgery, but I'm going to give myself one anyway, so we shouldn't be doing this, but just get this in real quick. I'm going to find Test Dog. It's a cute little Labrador owned by a devilishly handsome man. We're going to get them in just for, let's do a same day urgent visit. Never know what to get, right? And what is he going to come in for? To be limping on his left hind limb after chasing a squirrel. Giant squirrels. All right, so we're going to go ahead and add that appointment. And I know it's in the past technically, but just bear with me. So we're going to go ahead. We're going to get them checked in, right? So have them checked in. So that's the receptionist duty. They got their job done. For us doctors, we're going to come up in here, or really, I guess, our assistants. When we come into here, we have our same day urgent exam, same day urgent. You can find it here as far as under our schedule. You also find them in the flow board, right? So this is a good place to kind of see it where they are actually at, right? So we have our scheduled appointments here. But if they're actually checked in, this is great for you to know, hey, they checked this dog in. The dog is actually here. So as far as those assistants are concerned, if it's a long-winded history and you want to summarize that profile, use that summarization. If not, let's just jump in there and do what we have to do. Okay. So I simplified our exams. The first thing you need to do is you have to select a template because there's so many fields that can be filled out in here, and I just don't want you guys to have to worry about all these fields. Look at all those. There's just too many. Just way too many. Now, if we select a template for what they're here for, which is just simply an exam, pick that exam, check it out. That history disappeared. That's completely gone. All we have is the reason for the visit, our history. It's the only information that's underneath our subjective, and then it's simplified. I simplified all the other fields as well. But remember, use your quick soap. Use our quick soap over here, right? That is going to make our lives so much easier. It's going to simplify record keeping. So be sure to take advantage of that. You know, you can continue to run tests or do mock exams with your colleagues so you can get better at it. So if you have the time, definitely take the time to do it. All right, so real quick, we're going to run through this as if I was an assistant. All right, so we open up that quick soap, and we're going to start to record. Hi, Mr. Keel. My name is Blake. How are you doing today? Oh, I'm okay. Well, it looks like Test Dog's not feeling too well. What happened? Oh, well, he was standing outside, and all of a sudden, squirrel came over the fence, jumped off the hedge, just as he normally would. He's staring right at him, and poof, he just took off like a rocket. And when he ran back inside, he was only coming on 3 legs. I don't know what happened. Oh, that's terrible. Which leg is it? Oh, I'm not really sure. I think it's his left leg, though. Okay. All right. Well, that's definitely something we can help you get taken care of today. I'm glad you brought him in. What about any other problems going on? No, not really. If we can get that nail trim, I'd love to get that done as well. Okay, we can certainly do that. Any vomiting, diarrhea, coughing, gagging, sneezing, anything like that? No, none of that. Any current medications that he's on? Well, I'll give him fish oil. That's good. That's good to know. Okay, I'll be sure to let the doctor know. How about his current diet? Oh, I just feed him whatever he wants. Just you look at him. He needs it. Well, you and I can agree to disagree, but we'll see if that's acceptable for the doctor. All right, well, hold tight. I'm going to grab him, and we'll get you started right away. Okay, thank you. So after you transcribe that, remember, You don't want to come in here. You don't want to generate those soap notes. If you generate those soap notes, it's done. You can't actually redo it. You actually would have to redo it in order for because once you generate the soap notes, the entire file or record, soap record, will be completed. So you want to make sure that you're done with all the recordings that are required to finalize your soap. So that is going to be the assistant going in, the doctor performing their exam, any type of diagnostic tests and interpretations that you talk with the owner about. All that is important information that can get automatically uploaded neatly into our soap notes. So let's go ahead and start running through that. So my assistant Blake, he came in, he presented the case to me, and I'm going to go in and perform my exam now. Hi, Mr. Keel. I'm Dr. Parker. I'll be giving you a hand today. Blake told me that test dog ran after a squirrel and isn't feeling too hot and injured on that left hind leg, huh? Yeah, I don't think it's anything serious, but I just want to make sure. All right, well, let's take a closer look, make sure that we're not missing anything. And I'm going to start. I'm going to do his leg last. I'm going to do that left leg last because it's probably going to be painful. Yeah, that makes sense. All right, so let's get started, though. All right. Look at those eyes, nice and clear. Checking out these ears. Bit of redness in both ears. Some ceruminous debris, black ceruminous debris. Does he tend to get ear infection? Oh yeah, he can get ear infections from time to time, and I guess it is the time he starts to get his allergies. Okay, well, I know it's not what you're in for, but we can certainly take a closer look at that today, if that's helpful. Oh, please, that'd be fantastic if we could get something done with that. All right, yeah, absolutely. Keep moving on. Very minimal tartar buildup on his teeth. Nothing major. Continue. Feel these lymph nodes. Lymph nodes all palpate normal. Fantastic. Gonna press on that abdomen. A little bit tense, but most dogs are when you're pressing on them, so that's totally fine. No big deal. All right. Looking at his skin, it looks like he's got some salivary staining on all four paws. That's where they're excessively licking at their paws. Oh yeah, he's been doing that a ton lately. Well, that would make sense with the allergies if it's something he tends to get. So I think that's maybe something we can address today. Okay, thank you so much. All right, let's take a listen to this heart. Normal rate and rhythm, fantastic. About 104 beats per minute. Eutonic respiratory rate. Normal lung sounds. Get that temperature sitting at 100.1. All right, let's check out this leg. What's going on back here? In fact, I'm going to have my assistant come in and hold for me, if that's okay. Yeah, that'd be fantastic. All right. Thanks, Blake. Come on in here. If you could hold our animal. Okay. Hips palpate normal. No muscle wasting. Fantastic. Nothing at the paw. No lacerations. No broken nails. Moving up. Okay. Yeah, there's some swelling at his knee, at his left stifle. I'm going to perform a test here. Okay. And so he's got what we call positive thrust and positive drawer. Well, what's that? Well, it confirms that he has something called CCL, or cranial cruciate ligament injury. Are you familiar with ACL tears in people? I am, yeah. I actually had one myself. Yeah, so it's the exact same thing, but in our dogs. Oh, geez, that's just great. Well, it's okay. It's something that we're going to take care of. All right. So here's what I'd like to do. Starting with his leg, let's talk about that. I'd like to get some X-rays. Well, the reason I want to get some X-rays is it helps us look in the knee. I want to make sure that there's some swelling and want to see, okay, is there any arthritis going on in there? I also want to see if there's anything going on in the other knee, as well as those hips. If there's any arthritis in those hips, that can kind of compromise the ability for him to bear weight. And it's going to determine, what we think we should do moving forward, if we can medical manage versus taking him to surgery. Okay, that makes sense. Additionally, what I'd also like to do is I see that he's not on any heartworm preventative. The reason that's important is because if he develops any type of tics disease, specifically Lyme disease, then that can actually weaken the knee and cause a cruciate injury. So I'd like to run a heartworm blood parasite test. Okay, yeah, I get that too. All right, and then We're going to kind of go from there as far as what we're going to do, but we're definitely going to get him sent home on some pain medication, some carprofen, gabapentin. Those are going to be very helpful for him, and we'll go through all that when we get that together. Okay, great. For his allergies and his ears, what I'd really like to do is I'd like to clean those ears thoroughly, and then we have a medication called Simplera that we actually administer into those ears that lasts for 30 days. You don't have to touch them, so that way that gets taken care of. And we'll recheck those ears in about 5 weeks, make sure they're cleared up and taken care of. Oh, that's great. Now, we also need to take care of an underlying allergy. We talked about, yes, he has got an ear infection, but he's also looking at those polls excessively. When you get allergies, what can happen is their ears get hot and inflamed, perfect environment for bacteria or yeast to grow, and that's where they get those yeast or ear infections from. So what we're going to do is we're going to give him an injection called Cytopoint. That Cytopoint, it's a medication that helps block the allergy for 4 to 6 weeks. If for some reason it's not working, please call and let us know. Otherwise, you should see improvement with the licking of those paws in the next 3 to 5 days. Additionally, something we recommend is if outside of those, what did I tell you, 4 to 6 weeks that'll last for. So let's say at 7, 8 weeks, all of a sudden you're noticing that he's licking those paws again. Just give us a call up and ask that for his allergy shot or his Cytopoint injection so we can maintain control of those allergies. Otherwise, he's going to develop secondary infections like those ears or even his skin getting skin infections. Okay, that sounds great. All right, I'm going to put together an estimate. Once we get that estimate put together, we're going to make sure you're okay with all of that, and then we'll get started on our tests. Okay, thank you so much. All right, guys, now that we have our physical exam done, what we're going to want to do is we're going to go in here and we're going to create a estimate, right? So next thing to do, create that estimate. So remember, you're not going to generate SOAP notes. Do not clear all your information and do not sync with record. You're going to come up to this top right. You're going to just X out. All right. Now we're back in our SOAP. And you can either scroll with, use your mouse, use the touch screen. But remember, you guys have this up here, all right? These are jumps. You can jump wherever you need to go and get your things done, right? These are documents. Go to documents. That is where our estimates live. They're going to be called treatment plans, all right? So I'm going to come in and I'm going to add that treatment plan. And remember, we don't create new treatment plans. We need that estimate wording. So I'm going to browse those canned templates. It will always be that first one. I labeled it number 1. Make sure it's easy to find. So that'll be the first one that we're going to use. Now, I'm going to come into here, drop that down. Again, I just expanded that by clicking it. I have to add my services and products. So we're going to come in here. Exams have the medical waste built in, so there's no reason for any sort of putting medical waste in there, right? So it's going to be an injury exam. We're going to do an urgent or same-day fee because he was same day. We're going to make sure that we get a venipuncture. We can get that heartworm blood parasite test. We're going to get some radiographs performed. We might want a consult. We'll get the consult in there. All right, and then let's go ahead. I want to get some miscellaneous prescriptions to go home because I'm not going to calculate out those medications right now. It's just something that we can do in a little bit. Also, I want to get that ear cleaning. We're going to do our Simplera. Ooh, and remember, if it's something that's consumable, right? So that's something that we use. Make sure that you go to products. That's going to be a little bit something that gets a little confusing for us sometimes. This is kind of crazy right here. I don't know why it's saying that it's 396. Okay, that must be the entire case. So it's 39 per dose. So we get that in there. What else did we say? I think I said a Cytopoint. Now our Cytopoint, we are going to be using our services for Cytopoint. This again where it's going to get confusing. You're just going to have to remember these types of things. Let's see. So come over here. He is, let's say he's a big boy. He's 100 pounds. So we'll get the 100-pound dose. We already talked about our miscellaneous medications. Okay, so we're going to come down into our estimate. We're going to just double check. We have our exams, sick injury or same-day fee, venipuncture for a heartworm blood parasite test. Remember, if it's linked to something, so the heartworm blood parasite test is here. It has a sub-product. It's linked to that box. This means that it's using that. That's how we keep track of our stock. So leave that there. Don't come over here and remove that. Make sure you leave that there. It doesn't add on this price here, right? That's built into this price. It just tells you what that cost is. Let's see. We have our radiographs, so we're going to make sure we take care of that. This radiograph consult, for me, I'm pretty comfortable with my radiographs. Maybe we won't do it. Maybe we will. So I'm going to put a low quantity of 0, just in case we don't think we need to do it. For our miscellaneous prescriptions, I'm going to add on here maybe $100 just for prescriptions to go home. We're going to make sure we take care of that ear, that Cytopoint injection for the allergies, as well as our Simplera doses. There is going to be 2 of these, so we're going to make sure that we have 2. I don't know what happens if the low quality is 2 and the high quality quantity is 1. Kind of curious. Why don't we figure out what happens? All right, that looks pretty good. Remember, this is just verbiage. Just make sure we have some legalese in here. So with those touch screens, we can either review and sign. You can also request a document signature. If I do that, it sends it via text. So the person is going to get a text and they can sign right on their phone. If you want to email it, you can email it yourself. Don't approve or reject just because, again, we need signatures. So again, so let's say we're in the room, we got our touch screens, we're going to review and sign that. So the owner can come through here. This miscellaneous prescription. There are going to be external descriptions. So for example, right here, we have costs varied based on patient size, medication duration, and medical necessity. So that's helpful for the owner to know. That Simplera dose, it was going to be 2 to 1. So that's really weird, that high quantity. So make sure that we're going to be doing 2 of those so we can fix that. I'm going to go back and fix that real quick. So we're going to need to make sure that I'm going to talk to, we'll put a request into Digitail to see if they can fix that, because that's weird. If there's a low quantity, it should be a high quantity. It should be the same. So again, we're going to go into review and sign. There we go. We fixed that. All right. And we have now our estimate here. Okay. Let's say, for example, owner's like, wow, that's a little bit much for me. That Cytopoint dose, that's just a little bit too much to bite off of right now. We're going to want to fix that. So I'm going to come back. And we are going to, remember, don't delete. Only delete something if you put it there mistakenly. We are going to decline that X. So we're going to decline that Cytopoint. We're going to select a reason. Let's see. We're going to put cost concerns. We will reject. All right. Then we're going to go back in and we're going to review and sign that. Excellent. So we did reject that. Like Addie said, if we reject for cost concerns, that's fantastic. It doesn't actually give a description on why they rejected that. So that way we don't have to worry about any sort of owner embarrassment. So we're going to go in here. We're going to sign. Excellent. We're going to save that. Then you want to make sure they confirm the signature. Make sure it's not a smiley face, Miss Gabby. I hope that's not how you're signing your documents. Go ahead and confirm that signature. All right, signed and confirmed. And I did not change the estimate wording, so shame on me. Make sure that you guys change that so it says the right name. I'd like you to put it just as the date. If it's a surgery, I'll put the surgery, or any other procedure, I'll put that on there. So I just refreshed, make sure that that was approved. It's not in the plan yet, right? So what we need to do, we need to sync that into our plan. Excellent. All right, so why don't we go ahead and clean our ears and administer our medications. We're going to do our radiographs. And what I would like us to do is to interpret all of that, right? So I'm going to come in here and I'm just going to dictate what was done. Both ears were cleaned thoroughly, dry, and some Simplera medications were administered appropriately. There were 3 radiographic views performed. of the hips, left and right stifles. Hips were relatively normal. Some mild DJD of the left hip. There was stifle effusion apparent with visual thrust. Incidental finding of a BB in the right thigh. All right, now that we've got our treatments completed, we have our interpretation of those radiographs. I'm then going to go in and I'm going to talk to the owner about what was done, what we found, what we want to do. So we're going to go back up and record now. Hey, Mr. Keel, we have some findings. You got a minute? Yep. Yeah, I've got a minute. All right, excellent. So we've got those ears clean for you, the medication in those ears. What I'm going to do is I want you to come back, take a look at these x-rays with me. Can you do that? Yeah, let's do that. All right, so what you're looking at here, this right here is his left hip. There is a mild amount of arthritis change in these hips. It's not massively significant. At his age, 3 years old, it's definitely going to progress. It's going to be something that we want to keep an eye on. That fish oil that you're given is fantastic, but what even better than that is some glucosamine or joint supplement. So there's a product named Dosquin. I'd like to send you home with some today, and then what we'll do is if you like it, we can get you set up with our online pharmacy, VetCove, and then you can order it directly to your door whenever you need it. Oh my gosh, that is fantastic. I would love that. All right, cool. Now, moving along, we're finding here, I don't know if you got some neighborhood kids or anything like that. Oh my gosh, I cannot believe that. They're always out there shooting cats and birds. It is terrible. Yeah, I know. So that's exactly right. That's what those that is right there, a BB in this thigh, in his right thigh. So it's not a big deal. So just, if there's ever a problem in that area, sometimes they can cause draining tracts, but otherwise they're typically very inert. They don't cause any problems. Just be aware that it's there. Okay, well, I guess he's not going on a plane. Ha 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 ha. Yeah, definitely not going on a plane. He's going to set that metal detector off. All right, so looking at this left knee, so what you can see here is if you look at it in comparison to the right, see this black area in the right knee? Look how that left knee has a little bit additional white echo texture to it. You see that? That's because there is a fusion in that knee or swelling of that knee, very consistent with a cruciate injury. So because he has arthritis in that left hip and he has a cruciate injury on that knee, I highly recommend he gets a procedure called a TPLO, a tibial plateau leveling osteotomy. It's not something we perform here, but I'm going to get you a list of surgical specialists in the area that you can talk to that can get you a good idea of what's to be done. Typical price range for something like that is going to be anywhere about $5,000 to $7,000 these days. Holy smokes, that is insane! I know, but you know how it is. Life gets expensive. If that is not an option, we can always talk about more affordable options. They're not recommended. I will send you an article on a procedure that I perform called a lateral suture. All right. Again, it's not something I recommend for him because it's only recommended for dogs under 40 pounds. It's not something I would want to get for a test dog. Okay. Yeah. Well, why don't we get a list of surgeons and I'm gonna go talk to them. Fantastic. In the meantime, I'd really like to get him some medications. I'm gonna get him again, like I was talking about, some carprofen, some doggy ibuprofen, as well as some gabapentin. This is not only a pain, it helps with pain, but it's also a sedative, so it'll help keep him calm so he doesn't continue to injure himself. I want him resting, so that's leash walks only. I don't want him running around in the backyard, running up and down stairs, roughhousing with other dogs. So he is on bed rest until further notice, until we can figure out what we're going to be doing with that knee, okay? All right, he's not going to like it, but we'll definitely get it done. Perfect. I really appreciate that. All right, well, do me a favor. Go ahead and take Test Dog. Have a seat up front. I'm going to get those medications for you. We'll get you checked out and home as soon as we can. All right, fantastic. Thank you so much, Dr. Parker. Tell Blake I said thanks, too. Will do. You have a good one. We'll talk to you soon. All right. Now, I'm just remembering I did not tell him what his heartworm blood parasite test was, right? So if I said, if I forgot to tell him or I ran up real quick and I just wanted to tell him, okay, cool. Went and told him heartworm and blood parasite test was all negative. Beautiful, right? So I can add that in there after the fact, all these other findings. These are going to be put into the soap via the AI system as you normally would. So you don't always have to talk to it, right? It'll take that information, pop it in where it needs to be. Okay, so the next thing is you want to make sure we didn't forget anything, right? So I don't think I am. If you guys find something I forgot, remind me. I'll make another one of these and we can see if we can kind of streamline it so you have something to reference back to. And we all have something to reference back to on how to perform these soaps. All right, so now that is done, I'm going to generate those soap notes. All right. And it takes a little while, and it's going to automatically put that together for us. It's always a good idea to read through here just to make sure we're not missing anything. It pulls information from the file as well, right? So we didn't talk about him being 1 year, 10-month old. That was just something that was pulled from the patient information. You can see the patient details over here on the left, down here. Yeah. All right. So Eric Kia reports that test dog developed acute left-handed lameness after suddenly chasing a squirrel. Blah, blah, blah. No vomiting, diarrhea. Awesome. History of recurrent ear infection, pretty during allergy season. Excellent. Not on heartworm preventive. So remember, we didn't talk about that until later. So it's still put it in the right section, which is that subjective, that history section. So that's what's great about this AI. It's very intelligent. It really helps us put everything where it belongs. Now it's going to go through our physical exam here. So I have it set up to where if there's any type of abnormalities, it should capitalize the body system, right? So for example, it capitalized eyes. It really shouldn't have done that. And the reason it shouldn't have done that was because there was nothing wrong with those eyes. So it should not have done that. So, talking about AI being really intelligent, it has its drawbacks. It's not perfect, right? So is that the end of the world? No. Am I going to change that? Well, you guys know me. I'm OCD. I'm going to change that. So for future reference, if I ever need to look back at this record, I know the eyes were normal, ears were not. That's why they're going to be capitalized. I'm really hoping they start doing bold so I can bold those. So again, he had that ear infection. That's why it's going to be like that. That mouth had some minimal tartar. That's why it's going to be capitalized. And is there another body system that was abnormal? Absolutely. That musculoskeletal system, right? He has left stifle swelling with a positive thrust and drawer. So this is great. Look at this. Normal hips on palpation, no muscle wasting, no paw injuries. Hips radiographically normal with mild left hip DJD, incidental BB in the right thigh. Look at that. That is great. So that takes all that information that we took, that we found, and puts it in there for us to be able to either send to the specialist or give it to the owner so they know exactly what we're dealing with. I did not put a weight in here. Why don't we go ahead and put a weight? I said he was 100 pounds. All right. A respiratory rate. I didn't put a rate. I'm not usually great about doing respiratory rates. So a lot of the times I'll put Eupnic, which it's not letting me do. Interesting. I'm going to have to look to see if I can change that. So I'm going to leave that blank for right now. All right, so we got our assessment here: acute left pelvic limb lameness, rule out CCL, inform the owner of CCL injury, discuss surgical options, TPL ideal, lateral suture not working due to size weight. And that is just, that's great for the owner. I think that's just fantastic. Bilateral otitis externa, atopic dermatitis, food allergy, second malassezia or bacterial infection. Let's see, and that's underneath the bilateral otitis externa, right? So it's talking about ruling out, does he have an atopic dermatitis? Is it due to a food allergy? Is it secondary bacterial or yeast infection? What we did for that owner, instructed plan for recheck in 5 weeks. We got some allergic excessive paw licking and staining, seasonal pattern, concurrent otitis, ruling out these possible secondary problems. We don't have any secondary pyoderma. Didn't see that. I wish that wouldn't have put that in there. So I'm not actually going to put that on a rule out because it's not there. It doesn't exist. Cytopoint injection administered. Look at that. That is not something that we did. So that's, again, we need to make sure that we don't forget anything. You want to read through these records. Let's see. Oh, you know what? You know why it said that? Is because I declined it and didn't put that in there. So here's what I'm going to do. I'm going to come over here. I'm going to decline Cytopoint injection. Let's see what happens if if I rewrite these, generate these SOAP notes again. So let's go ahead and rewrite those SOAP notes. I decline cytopoint injection. All right. Da-da-da. Okay. Right, those eyes. Eyes were clear in both eyes. No discharge, no or redness notice. It should not be capitalized. That's weird. And now the gastrointestinal system. Like I said, it's not always the smartest. I'll have to work with the instructions as far as telling the AI what to do. So it's going to go back to do our assessment. Let's see if it declined that cytopoint injection for us. All right. Real-life toxin type, parasitic, no evidence found. Secondary bacterial yeast infection, risk it persists. Owner notes excessive licking paws consistent with allergies. Discussed and declined. So we discussed that cytopoint. So that's great because now it's in the record. Hey, I talked to this owner about it. They decided they didn't want it. I talked to them about fish oil, continue, joint supplement. Okay, good. You're clean administer some Plera, prescription of carprofen, and your weight. Strict activity restriction, surgical referral for GPLO, joint supplements. Completed and negative. So it actually gave us our results, even though that we didn't even talk about it. Just had to type that in there. Review hips bilateral stifles performed. Your infection recheck appointment scheduled in 5 weeks. Owner defined cytopoint injection for allergies. So there we go. So client education handout and CCL tears management prognosis and surgical options provided. That was that article that I told Mr. Keel about. Monitor right thigh for swelling discharge would be general recommendations, strict activity restriction. Let's see, administer carprofen and gabapentin, continue fish oil, monitor licking and chewing. Ears for signs of recurrence or failure to improve. Like this looks pretty good to me. So we're gonna send the referral list, right? Educated about CCL injury. All right, like I like all this, right? We're gonna go ahead and sync this with our record. So where these fields are filled, if it has a tails, that's where it goes, right? So under your subjective, there's one field that the quick soap will fill out, and it will automatically go in there. The same thing with here; it has one field. Now the vitals will always get filled, so you can see right here the vitals get filled. And I forgot to put in that weight, so we'll go ahead and save that weight. Let's say I took that respiratory rate and he was sitting at 24. All right, cool. But that clinical exam is here. Excellent. I'm going to go in. I'm going to fix my eyes. Why? Because I'm OCD. Fix that gastrointestinal system. So I'm going to say GI. I'll do a little eye so I know it's normal. Lab tests and investigations. So look here. It doesn't have a tails. So all those radiographs or anything like that, it's not going to be in there. I will eventually put in here anything that we run in-house, so things that are like manual ran. So let's say like a PCV total solid. I will put a PCV in here, so we'll have to manually put that in. But realistically, if you either write it in the quick soap or you speak it into the quick soap, it will put it into our assessment, right? So this is an assessment description. Talks about what we found. These really shouldn't be labeled 1, 1, 1, 1, 1. I would much rather them be labeled 1, 2, 3, 4, 5. That is something I'm going to just kind of work with, make sure we can get that fixed correctly. If you do a diagnosis, there are pre-written information pamphlets that go with these guys. Dr. Mira, if you like them, then use them. I wasn't too much of a fan. If you're not, if we're not too familiar with something, maybe we'll want to add that in there. I'm just going to add that. Wrong button. I'm going to add that in there just so I have a cranial cruciate diagnosis, right? And then, presumptive diagnoses. Like again, I might get rid of this. I'm not really a biggest fan. I really like having this kind of information here, right? We have these like rule outs that are going to be our description of what our major findings were, or when I say presumptive diagnoses, and then kind of what could potentially be underneath of it. And so this right here, I don't know if I'm going to use it or not. Okay, so we have that done. We're going to come down to our plan. This is where technicians, you guys, doctors, us, we're going to come in here and make sure that all of our services are in, our products are put in, and then any medications that we need to add in on here. So I'm going to come down and let's see. Let's check out a couple of these. We are not going to do that radiology consult. And so here's something. So because of that, it's a 0. It means that we're not going to do it. So it looks like it has to be greater than a 0. So it probably wouldn't. It has to be greater than a 0. So it probably wouldn't allow us to post everything or charge them out if that were the case. So we're going to delete that because we're not going to do that. It wasn't necessary. Miscellaneous prescription. Again, this is something that I use. Now, we need to make sure we get rid of this because we're not going to charge them out for a miscellaneous prescription. It's $0 anyway. So why would I even keep that on there? That'd be just kind of weird. So we're going to keep that off. We got some Player doses. We got our ear cleaning at the off visit. All right. I need to get my medications in. So let's come over here and get these medications. All right. And this is an active medication. So this is a medication that he's had in the past. So that's kind of like an easy way for us to refill any medications if necessary. But like I said, I'm going to get him some carprofen. That's going to be some 100 milligram. He's going to get, you know what, he could potentially use a refill. So I'll put 1 on there. All right. He's going to get 1 tablet by mouth every 12 hours for pain and inflammation. Give with food. All right. Any type of internal notes? No, I don't think we need to do any of those. How many do we want? I want to give him about 2 weeks worth. So he's going to get he's going to get 28. They're tablets. So we're going to go ahead and fill that. And then you're going to want to print this here, right? So this is going to be where you print. Now, we may not, I may not be actually set up for one of these. Oh, I do. So pharmacy label printer, look what that did. It made this all weird. I mean, I'm going to try to see if I can make this permanent so it doesn't constantly ask us every single time. You need to go to paper size. You go to paper size. You're going to come down to diskette, first one. If you really want to know the number, it's 3258, but diskette. All right, that's going to fix it. You're then going to print that. It's going to go over there. We're going to fill our medications like we otherwise always would. Let's go in here and get his gabapentin. 300 milligrams. I'm going to be thorough. Check his dose. All right, you big boy. So you are going to get 3 capsules by mouth every 12 hours as needed for pain and sedation. I can give you 1 of those as well. He's going to need a lot of them. Let's go ahead and just get 60. They're capsules. Perfect. All right, I'm going to confirm those. Don't worry about that. That's something I'm going to have to deal with. That's something I got to deal with later. Okay, we're going to print that one as well. It's going to yell at me again, so I'm just going to cancel, pretend we printed that. Beautiful. Now, what you need to do after this is we are going to, let's look, right? So it should be flow board. Patient is in progress, right? So because we started that, it was checked in, you opened up, it then went into in progress. So we already know that that is being taken care of right now. Okay? So that's fantastic. You can, let's go back in there. You can make it ready for checkout. So we just made everything ready to go to reception to get them checked out. And now that tells our front staff that we can get them checked out. So I'm going to come in here and bear with me. Because this is a section that I'm not actually great with. So, receptionist, I'm very sorry because I know I have not been good about that section of everything. But you guys don't like me working up there anyway, so probably better that I don't. All right, Bill, it's all good. Excellent. So we are going to, I think it's just add payment. So I'm going to add a payment. All right, and it's going to be card. It's going to be a Visa. The total add to balance, awesome. We need to add any there. Now, I'm not going to actually put this in because they told me not to. Because it's going to mess up the upload tonight once they're uploading anything. But that should, once that's finalized, that pending checkout will move over to here into the closed section. So we can see, okay, who is done for the day. Now, if you don't want to worry about seeing everyone that was done for the day, then what I would do is only go and see the no sale, maybe the pending, or partially paid. Because that tells us, okay, well, who still needs to get the heck out of here? Who hasn't been finalized and gotten home? If you want to see everyone, so again, use those filters. They're going to be helpful. On anything, tasks, anything as far as our schedule. So, if there's something on the schedule, let's see if I come into, dashboard. The dashboard, like right here on the schedule. I'm seeing everyone right now. I just wanted to see, select appointment status, select all, pending, reschedule, confirm, cancel, no show. So I can turn off all. And let's see, only pending, right? Does that do anything? That didn't do anything. So I don't know what that, it didn't actually save. That's weird. But I have Dr. Mirror and myself here. So what happens if I take off Dr. Mirror? There we go. I only see my appointments. So Dr. Mirror, if you don't want to care about all the appointments, just make sure you just select your own. I'm going to make sure I see everyone. So I'm going to turn on both of us. Same with these latest records, right? Do I want to see Dr. Mirror's records? I don't think so. I don't think I need to see those. I'll want to look at the support staff records. So I don't want to see Dr. Mirror's records. So I just want to see my own so I can have quick access to those. Tasks over here. I got some tasks. I have everyone selected. Let's go ahead and deselect all. I only want to see my own. That way, I'll only see my own. If you want to keep track of all the tasks that are being completed, then select them all. Anyway, I hope that was helpful. I know that was long-winded. Please ask us questions. This is not set in stone. If there's a better way we can find to do it, then we will do it a different way. If you do have questions about this, please let me know.